play the game the right way and you will get those points. So I want you to either A, think of what these are, if you feel like you want to play the game, put the answer choices in the chat and say, A is this, B is this, C is this, versus I will read the scenario and I want you to tell me what the diagnosis is. Is that cool? That's cool. So I'm going to read it. I'll do the heavy lifting. And I want you to tell me the diagnosis. Physical exam, nothing. FOBT. FOBT is positive. So there's blood, okay? EGD shows bleeding, duodenal ulcer. And they give it to you. They say there's an ulcer in the duodenum, all right? And it's bleeding. Biopsy of the gastric antrum and the body is performed, blah, blah, blah. Biopsy specimen is most likely to show what? You're like, oh. So by reading the last 3 lines, many of you already know the answer. If you know the answer, tell me in the chat. Put it in the chat box and tell me what the answer is. I like to see. If you're maybe a little shy, you can do a private DM. As long as I can see that. I like everyone to participate, but it's up to you if you feel comfortable. I will go to the top of the scenario. A 46-year-old woman comes from Ecuador, is admitted to the hospital, and has tarry black stools, epigastric pain for 2 weeks. Do you know what that means, guys? Do you know tarry black stools versus bright red blood? You have to know that, right? Tarry is upper GI bleeding, bright red blood is lower GI bleeding. When a patient comes to you and you have dry cough versus wet cough, differential shift, right? Yes. Same thing here. Diarrhea, bloody diarrhea, non-bloody diarrhea. Yes. Bleeding from above, bleeding from below. You have to know these things. And I'm sorry to say, you have to work on understanding which organisms can cause bloody diarrhea versus non-bloody diarrhea. Okay. And take time. Don't try to learn it all now. Take it from me. Make a list. First aid has it. We all have something. Say, I know the non-bloodies. And then later, maybe the next day, come back and review the non-bloodies, but then look over the blood diarrhea ones. You don't want to learn it all at the same time, because I'm sorry to say, it's not, the objective is not to learn it today. The objective is to learn it and retain it for exam day. You might be like, oh, I know it, I got it. And the next week you make the same mistake and you forget it. That's the secret to studying, is you have to learn it, understand it, and retain it for exam day. Please, that's important. Okay, so what's the condition? I'm waiting for you guys to put the chat. No one's chatting away. That's cool. What's the condition? What do you guys think? What do you think the condition is? I need a diagnosis. Diagnosis H. pylori. Awesome. H. pylori, right? Congrats. H. pylori. Yeah, it's awesome. H. pylori. So not only is it H. pylori, this is what I want you guys to do when you're using AMBOSS. You're like, okay, I thought it was H. pylori, and then I click it to confirm H. pylori. Yes. And a person has a bleeding duodenal ulcer, was found on EGD. The most common cause of peptic ulcer disease is H. pylori. You have to understand that this exam is very tricky because it's not one style of questions asked. There's a very few percentage of first order questions, many second and third order questions. They're expecting, the committee, the USMLE organization is expecting you guys to know a lot of most commons. That's it. So either you read the first aid, or you can't because it's too much, and then you go to dirty medicine and sketchy and this, and then you're like, I still don't know it. Take your time and understand little by little what each one means. Most common cause of PUD, H. pylori. All right, what's the answer? Now it's tricky, isn't it? Isn't it messed up when I say, yo, what's the answer? You're like, well, Stavros, man, I don't really know what the answer is. I'm not exactly sure what each one means, right? Okay, so in order for you to answer the question, I hope you know, in order for you to answer the question, it's either A, you know what the answer is, or you can knock out one by one. Fair? That's fair. Either you knock it out or you move, right? So because we're here as a team, we're learning. Everyone is here at different levels. Some are medical students, some are here past step 1, they're studying for step 2. Other ones failed NBMEs a few times, whatever it is. So we're here as a team learning, right? In order for me to feel comfortable that you're going to do well, to actually feel comfortable that it's going to work, because all of the doctors that implement what I do pass, because it's inevitable you will pass. Instead of just hitting the answer and move, I work on knocking out all the answer choices to work hard to help you see and feel the power of elimination. That's fair. So power of elimination should be on your vocabulary from me to you. Check this out. Gram-positive Lancet shape. What's that? Well, I can tell you it's gram-positive. I can tell you it's alpha hemolytic. I can tell you it is, what is it? Yeah, strep pneumo, boom. This is not strep pneumo, it's H. pylori we're looking for, right? Out. Cool. Dimorphic budding yeast. Well, that's Candida, isn't it? That's out. Cool. Teardrop shaped multinucleated trophozoite. Well, this condition is treated with metronidazole. This actually has voluminous amount of diarrhea, greasy stool, frothy stool, but it's not associated with any kind of GI bleeding. Giardia lamblia. The word metronidazole, gap, check your first aid. Giardia, entamoeba histolytica, trichomonas, anaerobes, boom, 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 right? This is what you need to learn to push forward. This is what I do in my QBank each and every day for your viewing pleasure and for you guys to pass the stupid test and move. Teardrop, Giardia. All right, cool. Down to 3. Spiral shaped, flagellated, short, non-flagellated, irregularly drumstick shaped. Can I give you guys a little hint? Yes, Dr. Stavros, please do. In order for you to do well on first aid, in order for you to do well in microbiology, you also need to know virulence factors. In order for us to survive and beat and create medications and really destroy the organisms that infect us or actually live in our bodies, but if there's an imbalance, they come and attack, we need to know virulence factors. Virulence factors are toxins, protein A, M protein, helps the organisms against being phagocytosed by us, helps the organisms invade our tissue, sleep rent-free on mucous membranes, and so on. So, irregularly drumstick, I can give you a hint. It has toxin A and toxin B. I give you another hint. You don't give Metro because Metro, it's resistant. You give vancomycin oral. I give you another hint. You could either get it if you have clindamycin as antibiotics, or you live with someone who doesn't clean their hands. Next thing you know, you get really sick and go to the hospital nonstop. C. difficile, C. diff. C. difficile has toxin A and B for C. diff, right? Toxin A and toxin B is for C. difficile. C. diff is your regular drumstick. All right, so that's out. Now here's the stupid problem. We know it's freaking H. pylori, and this test makes us feel stupid. Which is the answer? Does H. pylori have spiral-shaped or flagellated or short, non-flagellated? We have couple A's, couple of B's, couple A's, couple of B's. The answer is what? A or B, right? Sucks, because like, well, man, I'm close. I'm not sure. I'm not sure. Here you go. There's the answer. So I hope you know you should eventually learn cat-positive organisms. Cat-positive is pretty big. We have staph and serratia and Burkholderia. Don't memorize now. Repetition like I usually do, and it'll allow you the power to move forward. Urease positive is also important. They have a lot of organisms that are urease positive, but it's a shame for us to know H. pylori and then not be able to knock out the answer choices or get the right answer. So what I advise for you all to do is, if you want, some of you have really strong basic science foundation. Other ones, not so much, because you're working, you're in rotations, you haven't been in school for a while. I get it. Listen, I'm realistic too. So you go back and review the rest. You spend a few moments quizzing yourself on all of these. And short, non-flagellated, oh, Shiga. Shiga, short, non-flagellated, negative rods. Obviously, they can cause fever, abdominal pain. Ooh, bloody diarrhea. Yeah, of course, right? But bloody diarrhea would be low blood, low GI bleed, would be bright red blood. But this person said it was black stools, and the person said it was a bleeding ulcer. This scenario can change, and they can say nothing about a bleeding ulcer. They could just say, bright red blood versus black tarry stools. Then you know it's upper versus lower. And if it's lower, there's organisms that have GI bleed and other ones that don't cause GI bleed. Yeah. So this is what we do.